Hey guys, Dr. Scott Stiffey again today. I just want to make a quick video. I just had a patient come in and I thought it was kind of interesting how everything's kind of transpired over the last year for this gentleman. So he said he started getting a lot of neck pain about a year or so ago, and he went to his medical doctor, which, you know, I'm not trying to bash anybody or anything like that. I'm just going to tell him how the process worked. So he goes to his medical doctor, and she's like, okay, took an x-ray, said he's got a lot of arthritis, gave him pain pills, muscle relaxers, told him to come back in like 2 or 3 weeks if that didn't help. Okay, so he comes back in 3 weeks and says that didn't help him at all. And so she gives him more pain pills, more muscle relaxers, stronger dosage, and then sends him to physical therapy. So then he goes to physical therapy for about 3 to 4 months, like 2 or 3 times a week. He did about 24 visits, something like that, and finally quit. They wanted him to just keep going, but he quit because it made him way worse. He even said that some of the stretches they were having him do, he even hurt his shoulder. Now he can't even hardly use his shoulder. He's got kind of like a frozen shoulder now. And so he goes back to the medical doctor again, and she takes another x-ray, takes an x-ray of his shoulder, and refers him to a spine surgeon. The spine surgeon takes more x-rays and does an MRI and gives him an injection, and then gives him more pain pills, more muscle relaxers. Tells him to come back in like a month. So he comes back in a month, and guess what? He says he's not any better again. And so the surgeon says, well, I don't really want to do surgery on you, so I'm going to send you to a pain management specialist. So the guy's like, great, now I'm going to get, pain management. Awesome. So he goes to this other doctor, and then this doctor again does another MRI, more x-rays, and tells him he wants to do 3 injections. So he does 3 injections again, spread out over a few months, and says they did absolutely nothing. Said that he didn't feel any relief whatsoever, not a bit. And so then the doctor, once again, after all the 3 shots, because you only do like 3 in a year for this type, gives him more pain pills, more higher dosage, more muscle relaxers. And he's just like, I don't know what to do. I'm in constant pain. I've been going to all these doctors. I've done all this treatment. I've had 2 MRIs. He didn't know how many x-rays, just tons of stuff. Didn't help him at all. He said, I am no better whatsoever than I was a year ago. So he came in and a few weeks ago, and just after just a few adjustments, his pain's gone. He was a farmer. He's a farmer, and so of course this is like planting season, and even turning around to look as he's driving his tractor while he's planting and stuff like that, he couldn't do it because he can't turn his neck. And he's just blown away that he spent so much money, so much time. I mean, I don't know what his actual bills are. I was kind of trying to ask him to just see if he could figure it out so I could just have an idea, but he says well over $20,000, maybe $30,000, and didn't get any better at all. And he just came in for a few times, and we figured out what joints were not working very well. There was pressure on the nerve. We adjusted the joints. We got the pressure off. Now he's feeling a lot better, and most importantly, now he can function like he should. Now he's back driving the tractor. He can look behind him. He can turn his head, and he's very happy. I think that's some great results, and I just like to share with you guys because some of the patients ask me sometimes about different types of results we get. So anyway, I hope maybe that helps a little bit. I hope you guys have a great day.